And hello and welcome back. I'm your host, Dr. Bob Lee from 107.5 WBLS. And guess what? You're watching Open. Thank you so much for tuning in, and thank you so much for checking it all out. It's that live interactive program that brings the Bronx and New York City straight to your TV set. You can stay connected to us through social media at BronxNet TV. Now, leading things off, our first guest is no stranger to our BronxNet studio set. She's always sitting in this chair right here. In fact, she can usually be found on this side of the table, sitting in the seat, right?
Yes. You know, I came in.
Us.
Yes. I came in. I went right into
seat.
Bob's seat. I'm like, okay, oh my God, girl, sit down in the audience.
And she's jumping right on it right away. She's going to ask me the questions about what she's going to be talking about. Wow. She has a crossover TV, right?
Yes, crossover TV.
And she'll speak about how she's fighting to improve health outcomes for our people in our community and raising awareness on diabetes and so much more. So please welcome to the show. Kendra O'Hardy is in the house.
Woo, woo. All right.
Kendra's ready to go. She's like jumping right in.
Listen, I first want to say I commend you on all your work in the community, your efforts in the community.
Thank you.
And
thank you.
You know, you have your organization that you help so many, and it's a pleasure to come up. I'm representing Health People Today. The executive director of Chris Norwood said, Kendra, can you go up and do this interview for Health People? So Health People is partnering up with Dr. Dre, and Dr. Dre will be coming out for a big press conference on the steps of City Hall on November the 14th.
Oh, okay.
And it's about diabetes, and diabetes, it's like taking so many people. It's taking so many people. I've been a diabetic for almost 30 years, 29 years now. And it took my mom. It took my dad. My dad died in his 40s. He was renal failure on a machine. And I think now that, you know, this program, like Health People, this organization, if you don't know Chris Norwood by now, you need to know her name. She is the winner of the 2024 Anthem Whole Health Heroes Award. And that is amazing. She has a big article out, The Lancet and Cranes. And I just want to say, I love you, Chris Norwood. She has been servicing this community for over 30 years. She started out with women in HIV. And then she went right on to helping folks with diabetes, putting programs together for arches, men and women that have come out of jail, mostly men that have come out of jail, called arches inside of Health People.
Kendra, how did you first know that you wanted to get involved in healthcare?
This lady, it's this lady right here.
Ladies?
It's this lady. You know, I met her when my mom died. My mom died, and right when my mom died, this organization called Health People, they do a national diabetes prevention program, and it's before you get to become diabetic, pre-diabetic, and they train you and they work with you. They have peers that look just like me, you know, and I found out about that program. Then I found out about I lost 36 pounds, and that's when I knew that I want to be a part of this organization somehow.
So you just lost 36 pounds?
With this program.
Oh, with the program.
DSMP.
But what are the symptoms? How do you know that you're pre-diabetic without getting tested? You have to get tested or screened?
Well, I think I can tell you some signs and tricks to know, but I think
a lot of people don't know and don't pay attention to it. If they do,
I think the best thing to do is to have periodic doctor's appointments. We get so busy that we don't check on ourselves. And as Dr. Dre will tell you, when we do this rally on the steps of City Hall, I don't want to give you his whole story right now. He has an article that he did for Rolling Stones. If you want, you can just look up the article for Rolling Stones.
So he found out later on in life, too.
He found out after he had injured his toe. And it was too late then, because now he's injured his toe, the infection is severe, and now he had an amputation. So this is the problem. We don't know about our health, and if we don't know, how can we start working on things? So the DSMP program that Chris Norwood has is a self-management diabetes 6-week program. It's free. You know, we give it to you for free. You come in. We have peer-led groups, and you can start learning how to read labels, how to have that plate sectioned off. We're not going to be like, oh, you got to count all these calories, you got to be this. We want to meet you where you are. We want you to develop an action plan for your diabetes that fits you.
Yeah. We just had something up a little while ago. Put that back up so that she can explain what that is, and there it is right there.
Okay, so diabetes increased rate. So let's talk about amputation increased rate. This is it blows my mind. One amputation, if you think about it, is we're talking so much money that they're spending for one amputation. 250,000 in surgery just for one person. But just imagine how many amputations over and over this is going on.
Yeah,
Five boroughs across the world. Now the only thing that makes us different, and is that we don't have this remission program that they have across overseas. Remission means that help us stay well, help us do well.
Yeah.
Deliver the food to the doors like they did in overseas. They delivered the food to the door, the healthy food,
Yeah.
vegetables, fruits.
So it can be headed off. So you, upon finding out that you're pre-diabetic, you can start doing some things to help
Exactly.
eliminate the amputations and all the things that create that possibility for
Exactly,
amputation.
but we need the state. We need the state. We've been asking the state for funding for diabetes. This lady has to, Chris, I don't want to say nothing, but I don't want to talk about age, but this lady right here, take a look at this lady right here. She's up in age. And if it's the last thing that
Chris
we
Norwood.
do, Chris Norwood, the executive director of health, if it's the last thing that we do as peers and the staff there at Health People, is to make this dream that she has become a reality of the state, heading on a remission program, you know, and getting involved to reduce amputations, and also making the standards higher, so that what people don't realize, we have all these vein clinics popping up. And so that's what it comes to amputation, when you got all these vein clinics popping up and collapsing veins. So now we're moving on to the amputation, right? We're talking about amputation. We have all these clinics popping up. People are going in and they're doing things to relieve the pain. They think they're going to relieve the pain. But what happens?
Does that work? Are you saying that's...
We're worried because it's collapsing the veins. So some of these clinics, we have to find out.
So it's not good for a diabetic?
It may not be. It may not be. We don't know. But we need the state to investigate. Why are there so many amputations? Why is it so severe now, almost 100% from 10 years ago?
Yeah.
Where's all this coming from?
You know what I shared with people on WBLS, and I do it from time to time because I know in our community a lot of people are suffering from this degenerative disease, diabetes. Especially if you're born with it, that's type 1 diabetes. Your
You have
body's not
childhood
producing
type,
insulin or anything.
Right.
But your body does produce insulin, but sometimes with type 2 diabetes, the foods that we eat are eating up all the insulin, so it can't handle it. It's like overwhelming the insulin in our bodies. So I always tell people to go check out that glycemic index on the foods that you can eat, because I think over 70%, if it's over 70%, is going to eat up all your insulin that if your body is making it, it's not producing enough because of the way you're eating. So you can control it a little bit better with the way you're eating.
We got a lot of work to do, Bob. We got a lot of work. And what you said is very informative. But we have so much work to do.
Yes.
And I hope you can join us on the steps. I'm asking everybody to come out.
What's that date?
It's going to be November 14th. It's World Diabetes Day. And we're asking you to come out, hear Dr. Dre's testimony, and Dr. Dre from Ed Love and Dr. Dre, because there's two Dr. Dre's. And if you can see a picture up, I think we have a picture of Dr. Dre. So we put a picture, see, here we go. So I had the opportunity to meet Dr. Dre.
Dr. Dre, we love you, man.
I want to thank Heidi for making it possible. We went out to his house and we spent some time with him, and we talked with him. We talked over all the things that we need to do to make this possible. So right now, we need every city politician, the city, Virginia, Phils, the former borough president, and the executive director of Chris Norwood Development Action Plan, something lucrative. And it was supposed to be followed, and every hospital.
There she is. That's a good picture.
That's Chris Norwood. Look at this. Okay, you guys found that one. Look at your crew is so great.
We'll share it with you.
Yes. Okay. So Chris Norwood looking amazing, but she's getting up there, and now I've been running around with her for years, talking to every politician to help
You
diabetes.
spoke to a lot of the elected officials?
Every year
All
we
right,
run
listen,
down there.
I'm going to give you my camera. Maybe this one right here. You can say hello to my little friend.
Yes.
And you can ask for what you want.
Yes. So I am asking every politician, if you did not understand what Chris Norwood is trying to do, the executive director of Health People, I am asking you to please come down to City Hall, see the effects, the actual effects of what's happening with amputation rates to the roof. And we need funding for diabetes. We need some funding right now. We need it right now. So we want to say, cut it out and step it up. That is what we're going to be saying. Cut it out, let's step it up, and let's do something about this. So meet us on the steps of City Hall on November 14th. And when we come to you at 11 o'clock, when we come to you, just be ready to assist us and say, what can we do to help? That is all we're looking for, because we have to make a change, and we have to make a change right now.
And people who want to donate and volunteer, where do they go? Social
They
media,
can go to
website?
Kendra Hardy at healthpeople.org. Kendra Hardy, you can send me an email to Kendra Hardy at healthpeople.org. And then you can tell me how you want to be involved and what you can do on the day of. We just want everyone to come out, support Dr. Dre, hear his story. He's giving himself.
DJ Hollywood may be there also.
So DJ Hollywood, I just want to say this about DJ Hollywood. We were originally supposed to have him alongside Dr. Dre, but I spoke to him this morning on the way over, and he will not be able to. He's having some extensive treatments done that he cannot leave the facility where he is. And I want you to pray for him. You know, I want you to pray for DJ Hollywood. He is our icon, our pioneer, and he just had an amputation. And we're losing people. And
Well, we're going to continue to pray for him and a lot of the wonderful people in our community
Yes.
who are suffering from diabetes. I got 30 seconds. What's next with this initiative?
we want to see people on the steps of City Hall. We want to see that there is a diabetes remission program put into place. I want to thank the executive director, Chris Norwood, of Health People, for making all these things possible. She sacrificed her life. She lays her life down. She gets peers to train. We go into homeless shelters. We keep you healthy in shelter. So I want to thank you for your diligence and your hard work in the community. Thank you, Chris Norwood.
And I know you're coming on. You got Crossover TV. When is that?
So my birthday show is tomorrow night.
All right.
Election day, but I told people you better vote. You better go vote.
Yeah.
And before you come to the show, and we'll be on air for the 5th, and you'll see it later. And I'm super excited. My son's birthday is also on. We celebrate it live on air. He has epilepsy and autism. And the Christmas show is coming up. So the Christmas show with the Aquarius Boys Pay Up Management, which is IC's organization, is going to be happening next month. So stay tuned. My show airs every Thursday night at 7:30 to 8:30 p.m., and we'll give you all the information and updates. We thank you. We love you. We salute you. Dr. Bob Lee.
Thank you. Now come over and sit in this chair here. Kendra Hardy, host, Crossover TV. Thank you
gotta
so
be
much.
kidding. I love it. I'm going to give you a hug, though. I love you.
Love you too.
Dr.
Thank you.
Bob Lee. Thank you, guys.
All right.
All right.